it's a learning process. Again, you know, we house LGBTQ youth, you know, every day, you know, 7 days a week. You know, they live, they eat, you know, showers, share showers, you know, living spaces together. So it was definitely a eye-opening experience for me, because, you know, just, you know, again, everything that Andrew said is just, you know, so correct. They all come from different perspectives, different backgrounds, you know, and a lot of conversations, you know, had to be had, and we have them still on the regular, because, you know, we may interview a young person to come into the house and say, you know, they may be lesbian, and we say, you know, well, are you comfortable, you know, with, you know, a transgender or a gay male, and do you know what transgender is, you know, and having those type of conversations when they come in, kind of starts, you know, the dialogue, kind of starts them to thinking. It kind of gets them also to start thinking about, you know, what they say and not, you know, their own prejudices or biases that they may have within themselves. We actually, I think, have had, you know, a very good experience when it comes to, you know, LGBTQ youth together. You know, more of our issues are, you know, maybe like transgenders, you know, against each other, you know, because who's the most feminine, and, you know, just all of those little, you know, who's passable and who's not. Yeah, those are more, you know, more of our issue. But, you know, our males, you know, gravitate toward transgenders, our lesbian gravitate, you know, so they really become a family. And I guess my point is saying that I think the more that they are exposed to one another, that's when they do start to get more comfortable, you know, with one another. I'm somebody, and I use this story with the young people all the time. You know, me growing up, you know, in Oklahoma, I did not know what a transgender was. And, you know, now from, you know, that to, you know, working with the community, you know, when I finished school and things like that, you know, I'm probably more diverse than most, you know, gay men that I know, because I have probably more transgender friends than I have than anything. But that came from just, you know, my working relationship over the years. So I just think, you know, having those ongoing dialogues, you know, putting the young people together and having them, you know, kind of think outside the box. Those are ways that you'll get the kind of break down some of those barriers.
Cool. Let's take maybe 2 more questions if folks have questions. One there and then that's it.
This is a DCPS question. I know you're constantly revamping your sexual and reproductive health curriculum. Have you found that incorporating LGBT kind of youth behavior risk kind of information back into that curriculum has proven effective, or having separate training on it is what's happening there? I guess it's a 2-part question.
So we revised the curriculum about 2 years ago, and so we now have a grade 4 to 12, basically, so whenever you take high school curriculum for the sexual health unit. And it includes, I think the DC health standards begin sexual orientation. Diverse families starts around K, 1st grade, 2nd. But LGBT is introduced around the health standards, I think, in 6th grade. We started in 5th grade. And then it's in every grade, and also in 8th grade, and then through high school. And we were intentional about making sure that the relationships were inclusive and diverse as far as gender, and also that LGBTQ issues were incorporated into the curriculum so that it would speak to everybody. And that's the latest, the only sort of full assessment of that has recently occurred through the DC CAS. They added health questions to that. I'm not sure any of them were LGBTQ related, so I'm not sure we have a good sort of assessment there as for the efficacy of the curriculum and helping students meet the health standards. So I don't know how to answer the question there, but that's all part of sort of the broader sort of building a positive school community where kids sort of Glisten talks about the window in the mirror, where you incorporate LGBTQ work into the curriculum, not just in health class, but across the curriculum as a window into sort of LGBTQ issues for all students, so they can gather that exposure and build that understanding about histories. Bible is a great example. And then also as a mirror, sort of to affirm students who are LGBTQ, so they can see themselves in the curriculum and know that they are a part of the conversation. But that's just part of our sort of school climate.
Wonderful. And our last question?
Being that in my professional life, I actually work with a lot of LGBT youth, actually in DCPS, even though I'm not a DCPS employee. And I think it's a great campaign. I see the flyers all the time at the school that I'm assigned to. But one of the concerns from myself is that the school that I'm at, as well as the other schools that I've worked at, is that the conversation when it comes to LGBT youth, depending on the school, there's no equity across DCPS. And so one of the suggestions that I have, and I know that there's 123 schools, but especially since we're talking about middle schools, is that somehow even during the assemblies that are once a month, is actually saying, hey, if Smile gave a presentation for 5 minutes saying, hey, this is where we're at, this is what we do, X, Y, and Z. Because I think that a lot of kids, being that, because I'm there with them, a lot of kids, they don't know where to go. They hear these things because this is what their friends are talking about, all this other stuff. But I think if the service providers were to go to the school and say, hey, this is where we're at, this is what we offer, I think that's another way of engaging the youth, to make them feel that, okay, well, you came to my school, maybe I can come and try and see what's going on with this program or this organization or whatever it might be. And that's just not for a Smile. It could be MTA, it could be THE, it could be any of those. But I think that's another way of trying to get kids to feel engaged and feel a part, and maybe even go back to starting GSA at that school. So that's all.
Well, and to respond to that, I think that's a really great point. I'm glad you made it. We do, Smile at least does, and I know many of our partner organizations do as well, do some work within the schools, whether it's going to a health fair, stand at the table, pass information out. We also do a lot of outreach through gay straight alliances, whether it's going to an existing gay straight alliance and meeting with them and helping with capacity building and technical assistance, or meeting with either an advisor or a handful of student leaders who are trying to get a GSA off the ground and offering insight. It's something that we do, and something that we're actually looking to expand in years ahead.
And that was something that we heard from our schools, that they didn't know who the resources were in the community or how to refer for them. So we've done training. Metro GA does a great training on how to really do that referral, how to make a safe space for LGBT youth, and how to make a referral that sticks. And so, working with our staff on that so that they know how I'm putting community providers in front of them for training so that they can meet the resources. And we have we take lots of calls from families, so we decided to put something together that parents and other family members could sort of look at to find resources. But we have a similar version for our school staff of community resources so that they can sort of have a piece of paper, a cheat sheet, so when they're working with a young person, they can have that. Now, one thing that would be awesome if the city could do, 211 is where you can go for sort of community resources. It's one thing that when I have time, or maybe it's a great thing for an advocacy organization to take on. But to build out an LGBTQ piece of 211, because you can go to 211, it's online somewhere. That's how much I use it. But you can add content to that. So we as a community can build out an LGBTQ section. So if you are a caseworker or a teacher or whoever sitting with a young person, hold on, let me get a resource for you. We've done that internally with our Ed portal. We have an internal portal for all teachers and social workers and everybody in DCPS. And we have an LGBTQ section of that. It has a bazillion resources. Hopefully our biggest hit last week was, 2 weeks ago was National Coming Out Day. We made stickers for our schools and then told them which Avery label to buy and how to print it out and all that stuff. But there's tons of resources from local and national organizations and all of our training materials and posters and stuff. But that kind of sort of resource publicly available to the community.
Wonderful. Let's thank our presenters one more time. And then we have a couple announcements. looks like he's eager to say something.
I was going to ask a question to the panel before we wrap it up.
Oh, would you like to? Can we make an exception for Chris? Okay, one more question.
So very quickly, besides showing up on a Wednesday evening to listen to how we can improve LGBT health for youth, what's one thing, what's one short thing that you guys think that we can do to increase happiness, considering that you're competing with so much? But what's one thing, one quick recommendation that you can make besides signing the petition and giving you guys more money that we can do to improve LGBT health? As a wrap up question. 30 seconds.
Who wants to start?
I mean, I think that there isn't really. I mean, there's so many ways that people can get involved, and it's not just about. Like, it can be one quick thing. It can be a simple sign a petition, which makes a big difference. It can also mean making sure that when the oversight hearings are happening for DC public schools, you're showing up to express your support for the great work that Dion and her team are doing with no money, by the way. So imagine what they do this. Sorry, grab this. So this is like they put these great materials together with no money. Imagine what they could do if they actually had some resources for this. It also means being involved, both as a supporter and as a volunteer for organizations like the Wanda Alston House and Smile. I know I'll let Brian make a pitch for his organization. I know that we rely on individual donations. In fact, over half of our annual budget comes from individuals in the community. There are a lot of ways you can get involved, and the answer is that for us to really create change for LGBTQ youth in the district, we need everyone to be involved. We need people to think, and whether you can do all of those things or do one of those things, I really encourage you to take some action.
I would say just keep talking about it. Talk about it more in all the circles you run in. Folks know me, I'm always talking about puberty and gender identity, and those seem to be some of my favorite things. One, I talk about gender identity because of all the students that we serve, and then I talk about puberty a lot because my daughter's going through it. And those are sort of like living large. It's a unique experience. But sort of really seriously talk about the issues in your conversations. Anytime you have access to a parent, talk to them about the issues. If you talk about your coming out experience, talk about the ways your parents could have supported you better. Talk about the ways your parents did support you. Really sort of push the issue. Be an advocate in all your circles.
And sorry, I could say something more. And also for I know that there are some folks in the room who work with you for working with certain organizations. Find ways to bring training, to bring resources to your team, to your organization. It's great when we've got folks like me. I think I'm a good advocate. Folks like David, folks like Brian. But it's also really great when someone within our organization is saying, "Hey, we could be doing more for LGBTQ youth." That your voice will actually carry much farther than mine ever could.
Just